A very warm welcome to everyone. Myself, Dr. Rishi from the Other Song Clinic. On this very important day, the World Cancer Day, the Other Song Clinic has been organizing a very important topic, the prevention and the treatment of relapse in cancer cases. Today we have with us Dr. Sujeeth Chatterjee. He is the most senior homeopath with us. And we also have Dr. Urvi Patel, who has been also associated with Dr. Chatterjee, and she's been dealing with many cancer and pathological cases. So we are very fortunate to have both of them who will be sharing their experience in dealing with this condition which we always dread of. Dr. Sujeeth Chatterjee sir has been practicing since last 32 years, and he is very well known and has successfully treated many cancer and pathological cases homeopathically. He has been instrumented in the field of research, conducting provings of homeopathic remedies. Apart from being a senior consultant, an esteemed faculty member, and a core committee member at the Other Song International Academy of Advanced Homeopathy located at Mumbai. He is also a visiting consultant at BAPS Yogiji Maharaj Hospital, Ahmedabad, where he provides his expert opinion on treating complex cases at the hospital. The qualities that define him are he is so humble, almost every time, so dedicated to patient. People love him and respect him the way he is. And also the colleagues, we have learned a lot from him. So we are very fortunate and welcome Dr. Sujeeth sir. Dr. Urvi Patel is a consultant homeopath practicing at the Other Song Clinic, Mumbai. She works with as a senior resident to Dr. Sujit Chatterjee, Dr. Mahesh Gandhi, and Dr. Rajan Shankaran. It's very rare opportunity to learn with under these three major stalwarts of homeopathy, which has given her almost 8-9 years of direct learning clinical experience with these people. She has been handling cancer cases and the acute and pathological cases, psychiatric and autoimmune conditions. She is known for her patient care 24/7 into 365 days, always available. She is quite sincere, responsible towards the patient, and patient know her as a very calm, loving, and a caring person. So over to Dr. Sujeeth sir, who will be sharing his views and his vast experience about treating cancer cases and relapses. How does he see, and his knowledge and his experience will definitely help all the people over here. Thank you so much. Dr. Sujeeth sir, you can start your presentation.
Thank you, Rishi. Thank you so much. Prevention and relapse in cancer cases is my topic. Before that, hi friends, many colleagues, mostly my colleagues, students, some teachers, a warm welcome and good evening to all of you. So together we'll share our experience and we'll do our best to help the suffering humanity. So first, very quickly, what is cancer? Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Can you hear me clearly now? Everything is okay?
Perfect, sir. Perfect.
Okay. This process continues even if stimulus is removed. This is very, very important. If someone is smoking too much, having lung cancer, once cancer is detected, even if he stops smoking, cancer continues. Someone is taking tobacco, getting mouth cancer, oral cancer, he stops tobacco, but nothing happens. Still, it continues. Any cancer anywhere, even if the cause is removed, once the cancer is developed, then even if you stop the cause, like eating too much spicy food, getting gastric cancer, stop spicy food, but once cancer detected, then it continues. That's why it is so dangerous. The process continues even if stimulus is removed. Even if one cancer cell is left behind, it can grow and divide to become a new tumor. A new tumor can start to grow in the same area of the body where the cancer first started, or cancer may have spread through the blood or lymphatic tissue to another part of the body where it grows into a new tumor. For example, cancer can start in the breast, later on it can go to ovarian uterus. How the tumor is forming, this blue portion diagram showing how cancer cells keep on multiplying and a tumor is forming. Just it multiplies and it is abnormal from the normal cells and it grows. We are made up of trillions of cells. Billions is less, billions and billions, that is called trillions of cells. And over our lifetime, and they normally grow and divide as needed. When cells are abnormal or get old, they are usually removed by our immune system. This is routine. Everybody's body, there are cell multiplication and there are cells which are not needed and they are removed from the body. And this is controlled by the immune system. This process is called apoptosis. Cancer starts when something goes wrong in this process and cells keep making new cells and the old or abnormal ones are not removed. As the cancer cells grow out of control due to the disturbance at deeper immune system, they crowd out normal cells forming a tumor. And that's why this immune system is so important in cancer cases. And homeopathy, we aim at this immune system. What is cancer tumor? That is malignant tumor or malignancy versus benign tumor. What makes cancer different is that it can spread to other parts of the body, while benign tumor like wart, fibroid, they will not go to other part of the body. What is the cause? Big question. What is the cause of the cancer? Cancer cells develop because of the multiple changes in their genes. These changes can have many possible causes. Lifestyle habit, genes, you get from your parents, being exposed to cancer-causing agents in the environment, hormones, heat, all heat meaning there was a one type of cancer, now it is not there. In Kashmir, due to very cold weather, people used to carry a kind of shigri in the abdomen. And lot of these ladies, villagers, who used to carry shigris in the abdomen, they got cancer of the belly or abdomen. This is known fact. So many times there is no obvious cause also. We get a cancer cases, very hygienic, everything perfect, doing exercise, doing diet, no family history, nothing, but still cancer. We say karma, but it happens. What is relapse? Despite the best care and significant progress made in the treatment, cancer comes back. That's why it is so dangerous. When this happens, it is called a recurrence or relapse. That's why not a single allopathic doctor will never write cancer is cured. They will always write cancer is a controlled disease. Why this happens? By chemotherapy or radiation or surgery or immunotherapy, the tumor is attacked locally. As a result, the cells die. But body's tendency to form cancer cells and the disturbance at deeper immune level remains. And so they grow again and over a period of time. Very luckily, homeopathy can aim at this immune system. In allopathy, best chemotherapy, best surgery, best radiation, no medicine is available to aim at the improvement of immune system. Why homeopathy is so beautiful? Because it really aims at the immune system of our body. It increases the resistance. That is a proof fact. What do we do? How to prevent the relapse? That is the question, and that is the today's sharing and discussion. Can homeopathy help in prevention or relapse? How does homeopathy works? Homeopathy works through PNEI axis, that is psycho, neuro, immuno, endocrinological disturbance. Psycho meaning mind, neuro meaning nerves, endocrine meaning hormones, and immune system is immunity, lymphatic system, spleen, thymus, and our immune system. This all together is rectified by our homeopathic medicine, and this is work on PNEI axis on this homeopathy works. Scientifically, this is proved. Homeopathic medicines can address issues. What is the definite cause of the cancer? Even nowadays, my allopathic colleague agrees that a grief, a very strong grief, prolonged domination, like husband is dominating the wife for years, or father is dominating the daughter for years, or at office boss is dominating the subordinate for years. Prolonged domination, prolonged fear, prolonged, like the particular boy or son is too much scared of the teacher for 10 years, very, very scared. He can beat anytime something is wrong and he can be punished. And he's shaking, shivering with the fear for years. This can be very dangerous. It alters the immune system. Prolonged grief or unresolved issue, something very which you cannot communicate. For example, even I've got patient sexually harassed when they are young. Some own relative did it. Daughter wanted to speak it to the mother. Mother said, no, 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 he's your own uncle. Don't say all this rubbish. Keep quiet, never speak. Remains inside. Lifetime she cannot say this to anyone. This is very dangerous to the body. This can disturb the PNEI axis. So prolonged grief, prolonged fear, prolonged domination, and homeopathy is the only science which can address these issues. How? Our medicines are proved in human beings. Whenever we have given the medicine to human beings, unlike donkeys and monkeys in allopathic science, we call it healthy prover. We've noted down these symptoms can be produced in human being in the prover. Like Ignatia is a medicine. When we give the medicine and we note down, it can produce this kind of grief, silent grief. The prover doesn't share the grief, and inside there is a grief. Inside they can develop fear. So what medicine can produce that can cure is our theory. So when homeopathic medicines are proved in healthy human being, we see important mind changes, and there we have noticed these changes as well as very strong clinical observation. Let us share some of the cases who came to us to prevent relapse and avoid chemotherapy. Case 1, Mrs. D.S., 59 years, diagnosed with papillary thyroid cancer in March 17, already 5 years past, underwent thyroidectomy, meaning removed the thyroid gland, followed by radioactive iodine, which is a standard treatment in allopathy. In November 17, with CT scan showing a few 1 to 2 millimeter specks noted in both lungs, that is metastasis to lung, high TSH 54, normally it should be maximum 6 we allow, no medicine, but it was thyroid stimulating hormone was 54. Thyroglobulin level was 131. Dated 3rd November, which is very high. Actually, it should be around 60 is the normal. 131 is the thyroglobulin level. So she was again advised to go for radioactive iodine by allopaths. Allopaths said that it is a relapse cancer. At that state, she consulted us on 2017 November, that is 5 years ago, to avoid this radioactive therapy, to avoid allopathy, and she wanted total homeopathy. In this particular case, little technical thing, how homeopath sees her. Reports, we know thyroglobulin is high, TSH is high, it is a relapsed cancer. We have seen in the lungs, CT scan. Homeopath, that is important to manage the case. But what homeopath observes is this. She developed cancer while she was looking after terminally ill husband. She did not react, rather was focused on handling the situation one after other. Husband was bedridden. She had to go for surgery. And main worry was, who will look after whom? Shall I look after my husband? Her husband will look after me. No other family members available. She had to control and never let herself go under the situation. A very strong experience was helplessness and hopelessness. No hope, no help from anyone. For her, ethics are very important. She relates to childhood situation where again and again she felt she didn't belong to the family, felt lost. Everyone was responsible for me, but actually nobody was. Cannot throw tantrums, else no one will accept her. Maybe she was brought up in maternal uncle's place. She had to suppress her emotion. In various situations in life, she felt dominated and harassed. Various relationship in her life, main feeling was loss of love and grief. Basic nature, she loves sports. We asked the patient, what are your hobbies and interests? She loves sports. She loves basketball, which is a mixture of football and handball. It's a team game, and it's the second fastest after ice hockey. She loves that. She loves challenges, appreciation, self-respect, and self-esteem is very important for her. Very ambitious, optimistic, cannot tolerate injustice. At society meetings at her society, she felt sabotaged, insults. Her night dreams represented unsuccessful effort. Something in the dream, like she is climbing a staircase but cannot reach to the top. This is called unsuccessful efforts. Wants to go somewhere by a car, can't go because there is a breakdown. And feeling is, I cannot reach the spot, cannot reach the destination. Based on all this and her thyroid cancer, a homeopathic medicine was given, and over a period of time, we saw changes in her reports. April 19, her thyroid stimulating 17 she came. In April 19, thyroid stimulating hormone was 42, thyroglobulin was 130, normally 60, weight was 55. In June 19, TSH came down to 4.26 and thyroglobulin came down to 59.7. Actually, we changed the remedy after retake her case. We retook her case. When we changed the remedy, drastic change in TSH, drastic change in thyroglobulin. And we confirmed in July also, TSH further came down to 3.97, which is normal. Thyroglobulin was 58, weight was 66. She gained weight at one point, she was reducing, and allopathic doctors confirmed that now cancer is not at all active. Please share your experience
Yes.
with homeopathy.
Yes, Dr. Sujeeth has already shared about me. And yes, whatever he said, I confirm everything. For almost 5 years ago, I was written off almost as a relapse case. And I was not wanting to go for allopathy. So I came into the other song. I just walked in with a reference. And I said, I do not believe in allopathy because I have seen what happened to my husband. So I want homeopathy. So I was referred to Dr. Sujit and Dr. Urvi Patel, who took my history and who put me on the medication. And ever since then, there is no looking back. I've always been well, touch wood, and thanks to Dr. Sujit and Dr. Urvi Patel. I think my TSH levels are almost normal, except for 1 or 2 times when it went up. And I have been keeping very, very well. And I really thank the other song and the doctors for looking after me so nicely.
What is the role of homeopathy? What is the role of homeopathy compared to allopathic treatment?
The role of homeopathy, well, the best part is that homeopathy has no side effects at all. I can really compare with my husband because he had cancer and he was on full allopathy. And I saw him reducing his weight. I saw him not being able to function. He became bedridden, and all allopathic medicines were continuing in spite of the very high costs. And homeopathy does not have those costs. It does not have the side effects. And you can live a very normal life, which is something very beautiful, which unfortunately, I feel very bad and I regret that we did not use this for my husband, because at that time I did not believe that homeopathy works for cancer patients. But having seen what happened to him, I definitely did not want to go into the same trap of allopathy. And that is why with homeopathy, it's been a wonderful journey. But yes, I would like to also share that one also has to be very open with your doctors. You have to tell each and everything that is affecting you physically, mentally, emotionally, whatever. Try to remember your dreams and tell each and everything that is affecting you. And then I think the doctors can really treat you. So that's the very major difference between allopathy and homeopathy. No side effects, live a normal life. Costs are also not so high. Like allopathy, it is through the roof. So this is the difference.
Okay. Anything else you would like to say?
Well, I would also like to say that try to support homeopathy with your diet, yoga, whatever.
Yeah.
I think it helps also because I have been doing all of that also.
True. Very true.
And I'm very happy with the results. Thank you very much.
I should say thank you. Thank you so much. God bless you. Thank you,
Thank
ma'am.
you. Thank you.
Okay. Ji. Okay. Immunity is so important. Recently, I'm working with my colleague, Dr. Tariq Jagmag, who has done specialized course from Harvard and so many other university. And I would like to speak a little bit about immunology and the role of immunity, resistance power in cancer. Dr. Tariq, please. Tariq Jagmag.
I was thinking of what to talk about this. So what I've decided to say is that, well, we know that when you're using a homeopathic treatment, the doctor is looking at your psychological status and he is identifying which remedy to use for you based on your emotional status, based on a few symptoms that you may give, like if you're hot or you're cold, etc. But there are many other ways that we are now using to prescribe homeopathics. We have our own rat testing lab in which we run rat experiments. And over the last 10 years, we've actually been mapping out what these homeopathics are doing at a cellular level and at a hormonal and at an immune level. So we've reached to a stage where now we can look at a patient's gene report and we can identify which medication will work on him. So we can actually understand the pathways which are affecting your disease and target them. So that's the new thing that we're doing now, which I don't think anybody in the world has ever done. We have paper publications as well in international journals, not homeopathic journals, but allopathic journals. And that's where we are taking this. I recently had one medication of mine for COVID, which got approved by the government of India. And we're exporting it all over the world. It treats not just COVID, but also the fatigue caused after COVID. And the idea of how to create the drug came from my experiments on rats using homeopathics on COVID. So I mean, I have a lot to thank where we have blended homeopathic remedies with classical allopathic practice and blended this together to create a new form of treatment. In terms of why cancers recur as well, we found some very interesting things that we've done. You see, after you get chemo done or you get radiation done, what do you normally do? You go for a CT scan, you go for a scan in which an FDG dye is inserted in your body and it shows if there is any active tumor lesion. Many times when the allopathic doctor tells you that the lesion is gone and is no longer seen on the CT scan, he's actually wrong. Because even if you have 1 millimeter of that cancer, or even lesser than that, the cancer can spread and recur. These cells are known as very small embryonic stem cells. They're called as VSCLs. And until a few years ago, there was no method to test them. So we've been working with this US lab and we can actually take a blood sample. It's almost like a liquid biopsy. You can take a blood sample from your blood and send it to the lab for analysis. And if there are any VSCLs floating around in your blood, we can identify them to tell you that your cancer is not yet gone or it is recurring. Not only can the VSCL in your blood tell you what type, if your cancer is recurring, but it can even tell you what type of cancer you have. So there are many cancers in which we don't find where the primary lesion is, we can't find it. But using VSCLs, we can not only tell you what the primary source of the cancer is or from which organ it is coming, but also where it is going. That means if you have a cancer in the uterus, until now, and you don't know if it's spread anywhere else, using this, we can tell you that this cancer is going to spread into your lung next, it's going to spread to your brain next. And with this, we can also tell you the gene markers which are there, which are driving your cancer. So I'm hoping that we can take this research further with Dr. here, and we can identify the homeopathics and which markers they work on. So I'll give you a small example. We had a patient with breast cancer. This was about a few months ago, and the cancer was recurring over and over again. It was growing very, very badly. By looking at her reports, I found that her marker called as Ki67 was elevated. Now there's a very specific homeopathic called as tarantula, which downregulates it. We gave that to her, and literally within a month, the cancer had shrunk. It had shrunk to such an extent that with minimal amount of radiation and chemotherapy, it disappeared. So there are lots of such cases which we do. We do these cases worldwide. And I'm hoping now that in association with you, Doc, we can take this science far, far further. Because what I've seen, the kind of resistance that patients have against homeopathics is they think that maybe it's not predictable. And to a certain extent, they are right, because when you look at an allopathic form of treatment, you can say clearly that this chemo will work on the cancer. But in the homeopathic world, the patients are at times a little nervous that what if it doesn't work? What if it doesn't work? But if we can make this so scientific where we know exactly which remedy works on what marker, we can take the science to the next extent. And I'm really hoping with your help we can take this further.
The second case, a female 53 years age consulted me in 2015 September for oligodendroglioma, which is a brain tumor. She was diagnosed in 2011. She underwent surgery, but they could not remove the whole tumor. That is not okay. Brain tumor, when it remains, is not okay. It comes back. It was growing slowly. When she came to us, she had a lot of seizures, that is fits, and recurrent urinary tract infection. So I will request her husband to share. Just, I'm not telling the name. Okay, her husband's name I can say. Avinash ji, just share it now. You almost by heart everything. Avinash Deshpande, please.
Actually, in 2011, as it is stated on the slide, my wife got brain tumor, oligodendroglioma, on right side, right frontal portion of the brain. She was getting partial seizures. Her left side had become weak over a period of time. I mean, it started in 2011, 2012, she was operated. And over a period of time, her seizures were increasing, as well as the tumor also was growing slowly, though slowly. All right. After that, actually, we were not aware that homeopathy can help. Then we met Dr. Sujeeth, and he started with homeopathic medication. With that medication, her seizures were very much in control, and the intensity also reduced substantially, and her quality of life improved drastically. At the same time, the growth of her tumor reduced further, and the rate of growth reduced further. So that way, her quality of life really improved. And during her later on, the tumor increased to such a level that it had to be reoperated again. But during that, after that surgery, there was a chemotherapy given. During chemotherapy, also Dr. Sujeeth's homeopathic medicine has helped her to tolerate the chemotherapy very well. Now she is doing very well. I mean, right now she is doing absolutely like now. Of course, her left side is still slightly weak, but she is continuing with her normal life like anybody else. In fact, she is sitting with me. I will just
yeah. Hi, ma'am.
Hello.
Hi, nice to see you. Keep up the smile.
Yes.
Two lines. How are you doing? What is the experience of homeopathy?
I'm really doing great. Thank you so much.
Fantastic.
For all your medicines and all your timely help.
God's blessings.
To all the team members in your clinic. They have
Yes.
also been very nice to all of us.
Thank you. Thank you. Very nice to see you. Keep it up. Short, sweet. Okay. Thank you. Thank you. Thank you.
Normal, you can say. Let's hope for the best. Keep our fingers crossed.
Yes, yes.
And with your
Definitely.
help, still continue with her good life, I guess.
And very regularly they take medicine. Very punctual, very regular. Lot of trust.
Absolutely. I mean, total faith.
Yeah.
Yes, doctor.
Very happy to get this kind of regular patient. No problem, no fit. Absolute faith, full coordination. Very nice.
No reason to do kit doctor. We are very happy.
No, yeah. Thank you. Appreciate it. Thank you for your time. In spite of operation, the combination of homeopathy and allopathy here did the trick, and she did fantastically well, and fits her much less, which is achievement. Quality of life is good. At one time, she was worried about her son's marriage. Now, son is married, and touch wood, everything is fine with the grace of God. Third case, a very interesting case, challenging case, ovarian cancer, relapsed case, came to the Agasang, this patient in 16. My colleague and assistant, Dr. Urvi, will share the case.
So here, we had this lady who is 63 years old. She approached us somewhere in 2016, and she was a known case of ovarian, like she was an ovarian cancer case. And the family had not discussed at all about the diagnosis. So they underwent total hysterectomy. And so when there was metastasis, they came to us, like the family decided to take completely homeopathy. And so basically how we look at a case in a homeopathic ways, like what we found, what was very peculiar in her case is that she was very sensitive lady. And when someone says something to her, she would not react or she would not answer back. She would rather tolerate to avoid fights. At the same time, she also feels hurt, but she doesn't want to hurt others. She's a very anxious and a very dependent personality. And even the main incident that affected her was like there was grief about when the joint family separated, like they went, all the brothers went nuclear, and she was the most affected. What she missed the most in that main situation is that she felt very lonely. She missed the love, care, and the warmth of the family. And when we took all these things into consideration and we prescribed a remedy, so when she approached us, her sonography of abdomen that time in 2017 showed that there are 2 metastatic lesions in the right lobe of liver, and there were 2 metastatic lesions in the abdominal wall. And her CA marker was 40.2, which was it was quite high, CA 125. So this was in 2017. And when we started the treatment, gradually we could see that there was a huge change in her sonography report. So this was in somewhere in 2018, May. And we could see that there was only 1 single metastatic lesion in the right lobe of liver. One had completely disappeared. The 2 metastatic lesion in the abdominal wall had completely disappeared. And the single metastatic lesion which was there was also reduced in size. So, and her cancer marker like CA 125 had reduced, almost come down to 11, which was completely within the normal range. So I would like Sun to speak about their experience with homeopathy.
Namaste, sir. Namaste, madam. And namaste, all my friends and brother and sister. My wife had a
ऐसा बोला मैंने, उस शॉर्ट में एक्सपीरियंस बताइए, फिर अच्छा होगा भाई.
अच्छा ना, होम्योपैथी डॉक्टर सुजीत सर से दिखाने के बाद और डॉक्टर उर्वी पटेल, मैडम उर्वी पटेल को दिखाने के बाद, she is completely all right. 6 years has gone, but she is all right now. It is SC 125 is 9 and minimized. She is okay and she is very happy. We are also very happy and thankful to you. God bless you and give this type of treatment to all in India and foreign. We hope. Now still we are doing continuous medicine.
I should say again, thank you so much. Again, a very regular patient. They are from Ahmedabad. They come to us when we go once in 2 months, once in a month. Very, very regular. And really.
Thank you very much. Because of your fine nature and good treatment by you. So we are very helpful to you and you are also helpful to us. and so that my wife is survived from this
Thank
disease.
God blessings. God. We are
Thank you
just
for you. Thank you.
I
And
will
they're
share. I
completely
remember.
on homeopathy.
Yeah.
That is one of the best thing.
Yeah, I was coming to that. One day at this clinic, very busy clinic at the evening, suddenly he calls me from Ahmedabad and says, "Doctor, this type of relapse has happened. What to do?" Very challenging. It is she is quite young at her age, and whether to take chemo, whether to do surgery, and what to do. And my judgment was, we'll wait for a month, we'll give medicine and see what happens. So that way I handled the case, and I was very scientific. In 1 month, there is no result. If it increases, let her take chemo, allopathy. But in 1 month, size didn't increase. Slowly decrease was there, and that gave me confidence. I'm on the right track. And then slowly and steadily, and they had also immense faith in homeopathy. So I've learned a lot from this case, where a relapsed cancer case, you can really help the patient, and a staunch faith in homeopathy, some combination I discovered, some method I discovered from this case, which is helping many other patients. Thank you so much, Bhai. Okay?
Thank you so much.
God bless you.
Same to you.
Next, Urvi. Sorry.
Yeah. So we had another case also wherein, so generally, whenever patient homeopathy's turn comes very later stage, like whenever generally patients would not approach it at the very first time, but they would only approach us when allopaths had given up or when there is a relapse. Then they will start looking for alternative therapies, that let's start something, try something new. So we have some cases which has completely done well on homeopathy, and I will be sharing one case. So we had this patient aged 44 years old, and he was diagnosed with squamous cell carcinoma of mouth, and he was diagnosed somewhere in 2012, and he decided to completely take homeopathy. And when he approached us in 2012, if you can see, there are huge lesion within the buccal cavity, when there's leukoplakia and large tumor and all these things. When we took his case homeopathically, we understood him as a person, like what affected him the most. So what he said is his father's death was the main thing that affected him the most, and he missed his father a lot, and he used to get dreams about his father. In the dream, he would see that father is still there, and he gets this very good feeling that he's still there. The main feeling, what he felt in the dream was like, if the father is not there, then he says that it was kind of a lack of support and emptiness. He was feeling something is missing in life, kind of a lack of confidence to take decisions. So if father would have been there, it was very easy for him to take decisions. And based on this and his cancer, we prescribed him a remedy, and over a period of time, we could see a huge change in his lesions. This was in 2017, wherein it has completely, like, almost reduced to almost 1/4 the size. We could not see the leukoplakia also, hardly we can see here. And even in 2019, like, he is such a person wherein we have to push him that please go and get it checked, when he generally doesn't want to do it. He says, I'm much better, mujhe sab theek hai, mereko koi problem hi nahi hai. And he has a very good spirit, wherein we see this. So with cancer patients also, this spirit makes a huge difference. And when we did his sonography, when he forced him to go for sonography in 2019, it shows that there is a residual mass, but it has reduced marginally in size. There is no necrosis. When he came, there was necrosis also. I would like him to speak about it. It's been almost 10 years. तो महेंद्र भाई, कैन यू आप बोल पाएंगे कि आपको क्या फर्क पड़ा होम्योपैथी से? अभी 10 साल, ऑलमोस्ट 10 साल हो गए ना आप होम्योपैथी ट्रीटमेंट ले रहे हैं. Yeah, he is completely on homeopathy. Even in spite of telling him no, at times he still keeps taking tobacco, but that is a different story. But the way he is very good person. You should listen to his understanding. महेंद्र भाई, आपको समझ बात बता पाएंगे क्या होम्योपैथी से क्या हेल्प मिला आपको?
सर, मेरा जब मैंने बायोप्सी करवाया था तो ये प्रॉब्लम आया था, और मैंने और कुछ भी एलोपैथिक में गया ही नहीं, सीधा अदर सॉन्ग में आया। और आपका और उर्वी मैडम, मनीष सर, और सबका साथ रहा। आज तक आपके सामने चल फिर रहा हूँ, कोई प्रॉब्लम नहीं है, खाना भी ठीक से खा रहा हूँ, काम भी कर रहा हूँ और कोई प्रॉब्लम नहीं है सर। और मैंने आज तक 10 साल में एक भी एलोपैथिक की गोली नहीं खाई है।
चेंजेस क्या हुआ होम्योपैथिक दवाई से? फर्क क्या पड़ा आप में?
फर्क जो पहले कुछ मेरे को क्या नर्वसनेस थी वो सब निकल गई, अंदर से अच्छी फीलिंग आती है। पहले थकान लगती थी वो भी अब नहीं लगती है। काम भी मैं, मेरा ऑटो मैकेनिक का काम है, वो भी मैं ठीक से कर रहा हूँ।
और वो जो अंदर जो था मुंह में जो पर्टिकुलर जो घास हम जो बोल रहे हैं या जो कैंसर था, उसका क्या हुआ 10 साल में?
उसका सब पहले से तो बहुत कम हो गया। और सुबह जैसे आप ब्रश करते हैं तो उसमें भी वो पार्ट्स निकल जाता है, थोड़ा 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 निकलता जा रहा है।
पहले मुंह खुल सकते थे,
पहले कुछ कम था,
अभी काफी खुल सकते हो।
हाँ अभी पूरा खुल रहा है।
हाँ तुम खुल के भी दिखे, खुलो। ठीक है, ठीक है, ठीक है, ठीक है। This is the worst side effect in cancer mouth. When we take radiation, patient cannot open the mouth. But see, with it, that is the beauty of homeopathy. और कुछ बताओगे?
बस सर, मैं तो पहले गॉड फिर आपका थैंक यू करना चाहूंगा, आपका और उर्वी मैडम का, कि मैं अभी यहाँ पे आपके साथ बात कर रहा हूँ।
His son is studying homeopathy. God is great, and ये भी बहुत regular है। गुजरात गोधरा से every month he comes to take medicine. So regular last 10 years. And because little bit still remaining, that's why he is continuing the treatment. But salute, very very regular patient. Yeah, another very interesting case of thyroid cancer. 53 years male came to us at Adasong in 2013 with a thyroid nodule, underwent FNSC, that is fine needle biopsy, and did not want to go for cut biopsy, didn't want to take any chemo, radiation, and he had very strong fear of cancer and death because his brother suffered from pancreatic cancer and passed away, and he had seen him suffer immensely. So it was indirectly a boom for me that he didn't want any allopathy. On default, he stick to only homeopathy. How we look at his case, he had anxiety about family, love for nature, very strong fear of cancer and death, strong, silent, undemonstrated grief about brother's death. 2013, ultrasonography, a well-defined hypoechoic nodule with minimally irregular margins measuring 3.2 into 0.9 into 2.8, almost like 3 into 0.9 into 2.8. Few oval sub-centimeter right cervical lymph nodes noted. When lymph nodes are there with the growth, we suspect malignancy strongly. Then next slide shows again it was confirmed with biopsy that there is a malignancy in the thyroid, technical terms. After homeopathic treatment, investigation report in after 1 year. No solid cystic nodule, no obvious enlarged in the cervical lymph nodes, and so happy. In fact, National Geographic selected his case, but they wanted a core biopsy. I didn't argue. My very famous colleague, Dr. Bowman Dabar, said, even if the benign thyroid so nicely and so smoothly disappears with homeopathy with lymph node enlargement, it is achievement. No allopathic medicine can do that. Of course, it was a definite malignancy with FNSC and his family history and the way he suffered. But it was really, I learned something from this case, how deep homeopathic medicine can work and how quickly results can be there. And again, only on homeopathy. His thyroid nodule completely disappeared. He continued homeopathic treatment for a few years. He was perfectly fine. And we stopped his treatment in May 17 because there was no tumor, absolutely fine. He's still doing well, keeps in touch with me, sends wishes on festive days, Diwali holiday. This year also he calls me. Every year, New Year he calls me, and a very satisfactory result. Very, very satisfactory result. Next case again by Urvi.
Yeah, so this is a case of a male patient who is 45 years old, and he was diagnosed with renal cell cancer with metastasis to brain and lungs, and it was diagnosed in March 2015. So then he was advised to go for left nephrectomy, like kidney removal, and he underwent gamma knife for brain metastasis. And then he consulted us in June 2015.
One
And
second. I took 1 second. I felt when that other song I took this case, I felt bapre. Kidhar cancer gaya and what way? It is a very advanced case. That was my feeling in 2015. I remember at the lobby of the other song, his wife met me asking so many questions, and I was really shaky to give answers. Such a advanced cancer, and he has come, and wife was asking, he will be cured, no doctor. So I was saying, have faith in God. We'll do our best. That was my answer. But it was a very advanced case when he came. Yeah.
so next slide up shift करेंगे because I'm not sharing the screen.
Yeah.
Yeah.
Can you read?
So he recently went for this PET scan report, which was done in just October 2021, and it shows that there is no evidence of metabolically active recurrent disease. He's completely doing well. He's taking allopathy also. At the same time, he's taking homeopathy. It's been over more than 6 years, and there are no other recurrence anywhere in
Oral
the body.
chemo, na? He's taking some oral chemo.
Yeah, watery, and he's taking watery, and he's on currently watery and tablets, and it's been almost 6.5 years. तो संजू जी आप हैं ना यहाँ पे, आप शेयर करेंगे क्या होम्योपैथी से क्या फायदा हुआ?
होम्योपैथी तो था ना, it was like a मेरे को like a as a god, जो मेरे को मिल गया, एक दवा मिल गई, इन काफी मेरे को उससे फर्क पड़ा. जो भी मेरे साइड इफेक्ट्स थे, जो भी थे मेरे को जो मिल रहे थे, जो दवा से जो एलोपैथिक था उससे काफी मेरे को अच्छा रिलीफ मिला. एंड व्हाट आर द बेस्ट मेडिसिन एंड बेस्ट डॉक्टर्स जो मेरे को मिले, and other songs thanks to other song and Sujeeth ji ke doctors the and Urvi, all of them, the team has been done very good for me. And आज जो
very regular patient, whole family. Yeah, thank you Sanjay ji.
I'm always, मैं तो बोल रहा हूँ कि मेरे को डॉक्टर मिल गए, स्थिति के ऐसा गॉड मिल गए.
God की जगह पे है.
हाँ, पोजीशन में हर काम है पहुंच गया really. And medicines and homeopathy very helped me.
Would we want to ask him anything?
Yes, sir. I think he's doing quite well, no? Because for his case, we always thought that maybe there would be chances, but then touch wood, he's doing quite good. Like
this combination works wonder. Homeopathy and he took chemo. We nullified the side effect of chemo. We gave medicine to increase the immunity, and he had very bad backache. He was doubting whether it is bone metastasis. We did scanning and all report, everything normal, degenerative changes. His wife is so anxious, super anxious lady. Daughter is very stubborn, young, 21 years, young lady. In spite of that, see his smile, that speaks. Okay.
I have seen many patients, doctor, suffering with this cancer. And thankfully, I feel that we met you and Dr. Urvi and the other song at just a right time, because I felt in compared to them, my husband has not suffered anything because of you and the medicines given by you.
Objection. Because of God, we are nimitta. Okay. Thank you. Thank you so much.
Thank you, doctor.
Thank you, sir.
Okay. Thank you. Really. Perfect.
Thank you, Dr. Urvi.
Most welcome. So, role of homeopathy in reducing side effects of chemo and radiation. With chemo, excellent medicine, we have to nullify side effects 1 day prior, 1 day after. And to nullify the side effect of radiation, we have got very good medicine. It can be taken together, side by side, without any contra effect. Now we come to question and answer session. Very frequently asked question, can homeopathy and chemo and radiation be taken together? Already last patient with kidney cancer metastasis, he was taking chemo. So beautifully, he did well. Even with radiation, more better medicine for radiation with homeopathy, and definitely it works. A good teamwork is important. Very excellent doctor like Advani, Bowman Davar. I refer, whenever there is any doubt in allopathic side, I refer the case to Bowman. And whatever treatment he supports and recommends, chemo radiation plus homeopathy, so many cases are okay, doing fantastically well, getting lot of blessings because of this combination. And if I respect my allopathic doctor also respects me. No ego, nothing. I don't want to prove to allopath that homeopathy works. I take his knowledge, he appreciates our medicine, and in combination, I say him, whenever I meet him, I call him sir. Whenever he meets me, call me sir. It is very important. Full trust, full respect, not to prove superior, but in coordination. One and only aim is to help the patient, and that works. I'm again grateful to meet Dr. Bowman. Is such a lovely allopathic doctor. At this juncture, even just I must say, I remember one Dr. Vias, late Vias, one very bad lymphoma case. Doctor was advised to take chemo. I had a doubt. I was a staunch homeopath that time. No chemo is poison. Just Dr. Vias called me and said, Dr. Chatterjee, lymphoma is a small cell cancer, and in small cell cancer, chemo works. Just give a trial. And so beautifully patient did, so many years passed. So I've learned this thing from beautiful senior allopaths. And in combination, without zero ego, when I work together, results are fantastic. Of course, someone does his work, we are the media, but it happens. So some question answer at this juncture.
What about diet instruction? Dr. Girish has
Yes,
asked.
sir. Good evening, sir.
Good evening.
So can you hear me, sir?
Yeah, clearly.
So I am a young homeopath, and I have attended you through the other song, even in FCAH. So with when we are as beginners, if a patient approaches us with some CA, so really what should be our first response to them? Like, should we refer them directly, or should we try something? What should we do if a CA patient comes to us?
How many years experience you are having, clinical experience?
So I have 17 years of experience.
Yeah, you take it. You must take it. You must take. Also observe how much faith patient is having in you. Must be having faith. 17 years he has come to you. Take the
Yes,
whole
sir, but
case.
CA, I don't have any experience in CA.
No, if you get the total case, you don't differentiate between common cold and cancer. If you feel a homeopathic remedy X is good for the patient, confidently give it. First, try yourself. And if any difficulty is there, we are always there to help you. Then you refer.
Okay, sir. Thank you so much.
During refer, you just try to be present so that you
Yes,
learn.
sir.
Next time you need not refer. What are important symptoms? Why you are taking the case? In
Right,
past 20 years of my practice, whenever I used to refer any case to any colleague, I used to accompany. To learn was the most important motto.
That's
it was
right,
the
that's right.
opportunity. My case, no one can say no. This is why I learned so much. So that
Okay,
way you
sir.
can come up.
Thank you so much, sir.
Someone is asking about diet's importance. If you can, sir, you had mentioned in your talk, if you can.
Would we just cover it? If required, I will add something.
Yeah. So generally what we have read and heard about diet is that one is the big no that people say to is sugar, because generally sugar, the cancer cells thrive on sugar. But when they are taking chemo radiation, and when they are taking like when they are not well and not able to eat, that time we would definitely advise to take whatever best they can, be it sugar, be it a chocolate, be it anything, because we want patient to have energy to fight the disease. So that is one thing. But otherwise what we have seen very helpful in this kind of cases is very simple diet, not meat, red meat, and I think meat and chicken should be avoided. Sugars, not extra sugars, but you can take natural sugars like honey, jaggery, and vitamin B17. The fruits which are a good source of B17 has also been seen to be very helpful.
Like
berries. So kind of all the berries, all the berries, blueberries, raspberries, strawberries, this all help. The study shows that they are very helpful.
And more green vegetables, more fruits.
Yeah, absolutely. So
Thank you so much, Dr. Urvi. So in all, if no sugar, no dairy, and no animal protein has been done, it will really, really helpful. Thank you so much. There's a question. What is a good time to go for a radio chemo along with homeopathy? For how long someone should wait as a patient? What advice would you give?
First, after taking the case, if it is not very complicated, very advanced, for example, if a cancer is more than 5 centimeter, I feel immediate surgery is required. 5 centimeter is normally, for me, it is demarcation. If it is less than 5 centimeter, I give a homeopathic medicine and I repeat the MRI after 3 months. Again, Dr. Bowman advised me, we can repeat MRI in 3 months, but PET scan should be done every 6 months. So if in that MRI, if tumor is same or slightly decreased, I carry on my medicine. If tumor increases, I refer to allopathy. Very simple. First, I try myself, and when if a known allopathy is not there, some unknown, and how confidently he says, I just sometimes talk with the doctor, or I ask the patient. If doctor says definitely this will go with surgery, chemo, radiation, rest assured he will take it well, 100% confidently, I say that, I appreciate that, I encourage that. And when doctor, surgeon, allopath says it may or may not, we are taking a risk 50-50, I stick to homeopathy.
Thank you so much, sir. We'll take 1 or 2 questions more and then we'll wrap up. Ankur wants to ask some question. Yes, Ankur.
मेरे पिताजी को मेटास्टेटिक गॉल ब्लैडर का स्टेज 4 का कैंसर डिटेक्ट हुआ था इन द नवंबर, तो हम लोगों ने 3 कीमो दिए उसके बाद, और जैसे ही डिटेक्ट हुआ तो कीमो के दिन ही हमने आपसे कंसल्ट करके होम्योपैथी भी एज ए पैरेलल आपका चालू कर दिया था। लेकिन आफ्टर 3 कीमो देने के बाद उनको ब्रेन इन्फेक्ट हो गया, जिससे उनका स्पीच चला गया 2-3 दिन के लिए। एंड ग्रेजुअली फिर न्यूरोलॉजिस्ट को कंसल्ट करके उन्होंने मेडिसिन चालू किया, तो एडमिट करने के बाद स्पीच इज अप टू 70%, 60-70% तक मार्क्स तो आ गया है। लेकिन बिटवीन द कीमोथेरेपी आपका दवा चालू रखा तो थोड़ा सपोर्टिव रहा, क्योंकि कीमो ऑलमोस्ट मोर देन 6 वीक इट स्टॉप। अभी क्या स्टेज पे है कि मैंने डॉक्टर उर्वी से भी बोला था कि ऐसा है, तो आपसे कंसल्ट करने के लिए कि भाई हम लोग कीमोथेरेपी वापस चालू करें, और उनको ये मेंटल जो इन्फेक्ट आ गया है, तो कीमोथेरेपी की वजह से अगर कितना चांस रिस्क है इन्फेक्ट मतलब ब्रेन का, अगर नहीं ले तो ऑब्वियसली मेटास्टेटिक है तो वो फर्दर स्प्रेड। ऑलरेडी CA19.9 इज सो हाई, एक्सट्रीमली हाई नाउ आफ्टर कीमो बीन स्टॉप, और अगर कीमो ना ले तो यू विल स्प्रेड फर्दर मोर। अभी हमने सीटी तो नहीं किया है, क्योंकि एज यू सेड 6 मंथ के बाद ही यूजुअली करते हैं, लेकिन सिर्फ CA19.9 जो मेजर किया इट्स एक्सट्रीमली हाई। तो हम लोग
ऑन्कोलॉजिस्ट कौन है?
सुरेश अडवाणी सर।
हाँ, तो अडवाणी सर क्या बोल रहे हैं?
अभी परसों का उनका अपॉइंटमेंट लिया है, तो उनको एक बार फेस टू फेस जाके कंसल्ट करेंगे।
वेरी सीनियर लाइक बॉमन डबल, व्हाटएवर ही एडवाइसेस एलोपैथिक साइड यू लिसन। वो अगर बोलते हैं केमो लेने को तो ले, इज वेरी एक्सपर्ट।
ओके सर, जी सर, जी सर, श्योर
सर। उर्वी को बताओ, हम लोग भी जो कर सकते हैं रीटेक लेके, जो भी हम कर सकते हैं, we are not magician, every case cannot be cured.
In fact, I had given something which has responded very beautifully, like his speech has almost recovered to almost, I think, 70% or more than that.
Yeah. And also थोड़ा complication होता भी है, all cases we cannot cure, there are failure in every case, इधर थोड़ा complication हुआ, but still we'll do our best to help.
Yes sir, yeah, always Dr. Urvi is tremendous, very good response and very cooperative, always consulting you and getting proper advice, and we always follow all the advice. Thank you so much for all your valuable supports.
We are always there for you in every step of life.
Yeah, and thank you for all of your good service to mankind. With the God bless. Thank you so much, sir, once again. Thank you, Dr. Urvi. Thank you.
All the best.
Okay, thank you, sir.
It was a very, very informative and the vast experience of Dr. Sujeeth sir managing the cases since last 30 8 years, he gave a very nice introduction about how cancer starts, how it spreads. Even if you have stopped something which has been an addiction part of it, but it causes a stimulus which goes on, which is a cascading effect. And it was a very, very insightful information. And it definitely triggers the immune system, and through which these cancer spreads. We also had some information about the causation, which is very, very important part. And we have seen in this hectic life how the stress is working on all of us, and how we need to take care of it, and how the immune system is affected by our issues. And with the examples which were put forward, they were amazing how the cases have responded, like the relapse of the thyroid cases, the brain cancer, oligodendroglioma relapse, the ovarian cancer, the thyroid, and the renal metastasis. All those cases with the examples have made us got faith in homeopathy, and how holistic approach can really help in curing the cancer. And it's also very much important what he spoke about, the role of the collaboration and the integration with our fellow colleagues, the allopaths, who are also doing their best to help in this cancer. If we can join hands together and treat together, this will be the amazing part of it, which we would like to see in future to happen. We had also Tariq, Dr. Tariq, immunologist, who gave his vital sharing of research. And I believe that would be a path-breaking thing in near future for homeopathy, and also for this deadly disease, the cancer. And at last, the questions which Dr. Sujeeth and Dr. Urvi has given us the knowledge and the sharing about the importance of diet, how we can work together with chemo and radiation, and what are the points when we can approach homeopathy. And I believe the approach to homeopathy can be at any stage. It will really help to manage the condition well. If it's initial stage, it will be very good to help the boost the immunity and get out of this condition soon. So there are a lot of questions I believe people are asking, but you can write us on at the info@theothersong.com, and Dr. Sujit and Dr. would be very happy to reply it. And we will also be happy if you have any query with regard to patients, you can write to us. You can call us at the Other Song Homeopathic Clinic. We are available. We have the entire panel our place, and we'll be very happy. We have team, wonderful team. You know now by that time how patients have shared their experience with our team. So thank you so much being there. Thank you to patients who have expressed their sharing and the benefits through about homeopathy, and because of them the homeopathy has been spreading. Very thankful to all. Very thank to Dr. Sujit and Dr. Urvi.
Excellent, Rishi. Rishi is one of the senior residents, along with Dr. Devang, Dr. Pratik, Dr. Manish, and working since the beginning of the Other Song. Very dedicated, very sincere. So very nicely and rightly he said that together we can work. No ego, what best we can do to our patient. Once again, thank you to Dr. Tariq, thank you to Urvi, thank you to David, technical team, thank you to Rishi, and last but not least, all my friends, all my patients who are attending this seminar, precious time on Saturday, thank you so much. We will do our best to help the suffering humanity all together. Bye-bye. That's all.